If we can prevent cancer, why not?
I think that our guidance is really critical.
The best way to prioritize care for a patient is starting with listening.
I primarily treat a lot of patients with chronic diseases, diabetes and high blood pressure. And so we really manage risk, right? We're really involved in making sure that they have no long-term consequences because of these diseases. We as providers have the best of intentions, but if we're just not asking the right questions about what's going on at home, what sort of overall stress levels they're having, we can't expect these amazing outcomes on their A1Cs if, they're losing their home in 3 months. First of all, we have a great team here at Genesis from the beginning when our front desk calls them to make sure that they're going to come to their appointments, from the medical assistants calling them just to make sure they bring their glucose logs, because that's something that I like to see at every visit.
I think that's the beauty of Access. It has been shown that if everybody is on the same page, people will do it. Whenever you go in the airplane, it's not the pilot that tells you that you have to wear your seat belts and you have to sit and all the instructions. Everybody in that plane is preventing tragedy. It's the same thing that we need to do in healthcare. Me as a pilot, the leader of the team, but also my MA and the person who's gonna get the kit, we all have to be on the same page. If I'm only telling the message, they will forget.
From the day you're diagnosed, we can't assume that you know absolutely everything about diabetes, and so many times we make that assumption. And so I think as providers, it's really important that we constantly educate our patients, we're be it one visit about carbohydrates or another visit about what their medications do. And sometimes it's also just important to talk about what the real disease is.
I think it's the trust issue. They know that I won't suggest anything that I won't suggest to my family members. I see my patients like they're part of my family. They're my extensive family.
I could think of one patient in particular that I think we've made a really big impact in her life. She'd been my patient about 5 years and had some really down luck. I think she finally sort of decided to get herself healthy, and through very moderate weight loss that we were able to assist her with, she was first able to get rid of her blood pressure medications, and then her diabetes went from diabetes to pre-diabetes to now sort of not even being detectable. She's a great example of the fact that this isn't something you necessarily have to live with all your life, and I think she felt that we cared, and I think that also made her care even more.
My first name is Maryam, and I've been with Access since 2000.
Wow, Miriam, we've had a journey. So I connected with Miriam back in 2015 through our Care Coordination program. And I gave her a call and we started talking about her health, and I got the feeling that she was like, who is this person? And how do you know me and why are you calling me? Am I wrong?
You're absolutely right. I've been seeing doctors so many years, never got these phone calls. I said, okay, who is this person? But he knows so much about me. Then he started talking about, his services and everything. I said, oh, that's different, that's new. And that's why, how we start staying in touch. He calls me right before my appointment, remind me, do I have enough medication? Do I need a refill? I never had anything like that. This is unbelievable how much he knows me. Even when he calls me, the tone of my voice, he knows something's wrong. So I cannot hide anything from him.
I know. It was a challenge at first for me because there were a lot of things that we needed to do.
Yes. Caesar calls me. It's time for the eye doctor. Your blood work is going to be due. He makes all my appointments. You just call the other doctor. When are you going to see your surgeon? I don't need a reminder book. Here's my reminder book.
I didn't want you to wait for me to call you.
Yes.
And that was the real job, I think, is to build the trust.
Absolutely,
Because
yes.
anybody can tell you what you need to do, but if you don't trust that person, you're not gonna do it. What I consider health is looking at the patient from a holistic approach. We're not only talking about your diabetes, we're not only talking about the risk for cancer, I also want to know about you, your family, because that impacts the way that you take care of yourself. Because me as a patient, I would like to be listened to. So that's what I give. And I saw a huge difference once we started talking. You felt more relieved. You were smiling more every time I saw you. It was rough at first. I remember this one time, maybe about a year and a half ago or so, I went in the room, and she told me, I can't do it. I can't do it anymore. I don't want to take care of my health. I have so much going on. I'm giving up. And that broke my heart. I grabbed her hands and I'm like, we're gonna get through this. You remember that conversation?
Yes.
Yeah, we're gonna get through this, we're gonna do this.
And we
you
did.
know, and we did. It was very important for me that I made sure that she felt heard, listened to.
That helped a lot. When I went through that difficult time, I lost myself, my family. I'm a strong person. I lost myself, so I couldn't be there for them. Little by little, I got everything back. Because I was able to tell him about my problem. If I didn't tell him, he couldn't help me. And if I didn't get that help, I wouldn't care about my physical issues anymore. And that was a big step. And he helped me. He really held my hand and took me step by step. I'm going to be grandma's for second time, and the baby due in February. I want to quit smoking. That's my goal. I had that goal so many times.
And I have it on tape so I can hold her
Yes.
to it now.
But now I'm in such a good place that I want to do it. I want to take care of myself.
Now that she's ready, I'm gonna be her support. I'm gonna continue to be her support, just like I am for everybody. And I think that's one of the biggest things is to have a support system, outside of the family. Somebody that can keep you accountable. And I think that's gonna help.
I'm a happy person. I'm back to myself again. I missed and my family missed. I'm back again.